Today I'm honored to welcome Dr. Maher Hassan, a leading authority in surgical oncology at the Oncoplastic Breast Surgery from Egypt. Dr. Hassan is a professor of surgical oncology and oncoplastic breast surgery at the National Cancer Institute, Cairo University, and the head of the breast surgery department of Bahia Hospitals. He also serves as vice president and the medical council and a member of the research center and institutional review board. He also heads the patient navigation committee at the Bahia, where he plays a very central and critical role in advancing high-quality, ethical, and patient-centered breast cancer care. Internationally, Dr. Hassan is a board member of the International Representatives of the Egyptian Society of Surgical Oncology and a member of the International Society of Surgeons, Breast Surgery International. Dr. Maher, it's a great honor to welcome you and have you with us today in India. And on a personal note, I want to say I was a couple of months ago in Cairo, and I was completely floored by the work you are doing and the center that you have put up of international excellence. I have yet to see such a beautiful, dedicated breast center to the patients. What really touched me was the holistic part. Apart from the treatment, the surgery, chemo, radiation, all hospitals and everyone have, but what you have is very special. What you have downstairs is you have a room where the patients come and their makeup is done when they lose their hair, when they've lost their eyelashes. There's a place where the patients come and they do sewing, they learn sewing. And those gowns and all were first sold to the hospital. Now they're getting orders from other places and other hospitals, and the patients are getting orders and they're making clothes and selling it outside. It was phenomenal what you're doing. I'm very, very, very impressed, Dr. Maher.
First of all, it's my honor and pleasure to be invited to this prestigious conference here in Kona with you, Nadia, and my dear Professor Anand. And it was our pleasure to host you in Cairo. And I think it will be repeated many times. So it was a pleasure for us to invite you. Actually, in Bahia Hospital, we look for the patient in a holistic approach, as you mentioned, that they are taking the care of the patient as a whole, not only treating the disease, but only treating the whole journey of the cancer treatment. As you know, this is a long journey, so we'll take care about the patient and the surrounding, her family, and her hopes and their future. So you can involve the patient in the treatment journey as a whole and make the patient feel that she is at home, not only a hospital.
Beautiful. It's often said that when a patient comes, you have to treat the patient, not the disease.
Yes.
And if you do that, then you have won the battle.
Yeah. So it's our theme in the hospital. We are treating a patient and not treating the disease. Yes.
I'm very wanting to speak to you about awareness, because I think you have created huge amount of awareness at your hospital. You have buses and you have a lot of camps and you go out to treat patients. I wanted to know that do you find a very big difference when there is awareness created among women, and do they come very early since they are aware compared to the ones who come late and don't have awareness? Is there a difference in that?
Yeah, for sure. We started the awareness sessions in 2015. It was the core concept of the hospital to spread awareness among the Egyptian females, because we believe that awareness is a core for the management, because awareness leads to early detection, and the early detection is a core of treatment and success of the treatment journey. Because when we discover the patient at an early stage, we can offer her a less invasive procedures and less chemotherapy and better outcomes. So if you want to look about the treatment journey, you should consider that you can catch the patient in a very early stage, and this will not be done except by spreading the awareness.
Very true, because breast cancer is known as the best BST cancer, because if it's picked up early, it's completely curable.
Yes.
And like India, even in Egypt, breast cancer is the largest cancer in the pie, because it's the largest woman cancer and the largest cancer. And in India, we find, because we create a lot of awareness here, and we find that most women don't know anything. They don't have awareness. They do not know how to examine their breast, self-examination. They do not know the early signs of breast cancer. So do you find that same issue in Egypt, where you're trying to help and outreach to more women?
Yes, actually, we focused on the awareness about two important points to teach the females to how to examine herself, how to be aware about the symptoms and the signs, and also that there is an existing treatment protocols in Egypt that's like the approach. So, and the hospitals are available, and all the facilities are available. Actually, we find that many women that didn't know that there is this holistic approach is present in Egypt, or so. Once they came to the Haya Hospital, they found that is an amazing place. We don't know about it, so we have to spread the awareness about the existence of the hospital and the concept of the self-examination and the treatment approaches.
That's wonderful. That is the only way to go, because that is the way that, you create awareness to 10 people, they share it with the next 10 people, and it's like a cascading effect. And that's how it goes on. I find in India, I don't know whether you find it the same as in Egypt, that creating a high awareness on social media doesn't always translate into early hospital visits. Like sometimes on social media, Facebook, Instagram, we do post signs and early signs of breast cancer and what to look out for. But sometimes it doesn't register the woman. And it's not necessary that they come for a pre-examination, So do you find that is an issue also?
Yeah, it is important to spread the awareness through the social media, but what's more important is to go for the hospitals, to go for the schools, to go to the companies, and the spread awareness directly to
one-to-one
with direct contact tools, group awareness. We have many awareness sessions all over the year. And we focus on October, the
breast cancer month.
Breast cancer month, so with many awareness sessions all over the country, with a large team of doctors that go to every single small place in Egypt,
in the fringe areas.
In different governorates, to give the direct awareness to the groups. So direct contact, direct communication, and they receive their questions and they receive the inquiries about and remove the fears from the treatment journey.
Very, very well said, because the main thing is the fear in the treatment journey. When a woman hears about breast cancer, the first thing she thinks her breast is going to be removed. She's going to be mastectomized. Yep. She's going to die. So it's very, very important to make her realize that today breast cancer is completely curable and picked up in early stages 1 and 2. And in stage 3 also is controlled.
And even when the patient needs mastectomy, you can go for reconstruction and get her in good shape. But the only concept about the breast cancer is once breast cancer is existent, so it's only for mastectomy and only for there is no cure. But when you focus on the awareness, there is a new hope, there is new modalities of the treatment, and you can offer oncoplastic breast surgical techniques.
Absolutely.
So the patient will be as it is. And to keep the shape of her breast, she can come and complete her journey.
So when Dr. Maher speaks about oncoplastic breast surgery, it basically onco meaning cancer, plastic meaning the plastic. Yeah. They combine both the cosmetic and the cancer. So in the same surgery, you remove the cancer and you recreate her breast to look as natural as she can, very often using some flap from her back or using the fat from her stomach. So she opens her eyes after surgery and the cancer is gone and she has better looking breasts probably than before, because many women are in their 40s and 50s who've got breast cancer and the breasts have become ptotic, in the sense they've drooped. So the breasts are lifted and they are, she's given a better quality of life. And it's very, very important that her sexuality, her body image, everything is kept in mind when she's up.
Actually, you are taking care of all of this.
Absolutely.
Starting from the treatment protocols and its side effect, they can give a treatment to relieve the side effect. And the surgical approach is that's completely changed now to just conservative treatment, just removing the tumor and keep the shape of the breast, or even if we need to remove the whole breast, we will reconstruct it either, as you mentioned, with autologous tissues from the body or the implant or the silicone
there's so many
implants. So
the
there is,
options,
yeah,
depending on
many,
her body
yes,
structure.
many variations. So we can offer her the best outcome for her.
So this is very, very important because that a woman realizes that when she has breast cancer, there are so many options for her to heal and look complete again.
Yes.
Dr. Maher, in India, we find there are a lot of misconceptions about breast cancer, and they feel they're going to die the moment they're diagnosed. They feel many marriages break up in India sometimes. There are many social issues. They feel they're going to lose their breast and they will never be whole again. Do you have these same misconceptions in Egypt, or do you feel there are other things the
Yeah,
patients are worried about?
there is a book now that is written ready to be distributed in Bahia for about the myth and truth about the breast cancer.
Oh.
So this is the main role of the awareness to remove the fear from the vision from the treatment journey and to the misconception that cancer is fatal and there is no
Yes.
hope and once you started to remove this wrong ideas about the cancer, the patient will find the hope and you will find all modalities of the treatment. She can go for treatment journey.
Yes. And in India, we also have different misconceptions that if you wear a red bra or you wear an underwired bra, you wear a colored bra, you get breast cancer. So these misconceptions are also cleared when you create an awareness, right? So that is very important. What is, do you think is the community level awareness make a difference in the survival rates in Egypt? So do you feel that this huge amount of community awareness that you create through these buses and going to companies and schools and everything, do you find that has made a very big difference in the awareness in your country?
For sure. Actually, in Egypt, we have many initiatives. The main one of the presidential initiative for awareness and the early detection, and the institutional initiatives in the National Cancer Institute and the Bahia Hospital. So there is dramatic change in the concept in Egypt about the understanding of the breast cancer management, which was reflected on the stage of the disease. So once the patient come in early stage, we found that the survival rates is better, and we maybe change it in the last 10 years. Dramatic change in the survival rates because of the early detection.
That's wonderful. Yes. Good amount of awareness. And also in India, we find a lot of stigmas with breast cancer. For example, a woman is the pivot of society. So she's either a mother or a daughter or a wife, and she's looking after her parents, her husband, her children, her family. She never really looks after herself first.
This is the usual.
Yes, usual.
Yeah,
and
the last one to think about is
so in India, when I go and give talks, I encourage the men, the husbands, the fathers, the brothers to be there, because I feel if you create an awareness among them, they will make sure the lady in their family will also go for her preventive checkups. So do you think that is also important in Egypt, and is there any stigma to it, or do the women go for their checkups preventive, or is it the men who lead the way for their wives or their mothers to go and have a preventive checkup? Do you find that's
yes,
it's more or less the same?
In our sessions, you will not only directing the sessions to the females, but to the whole family, especially the husband, especially the male in the family that lead the family, because usually the female don't think about herself at all. Usually think about the her family and the daily work and everything.
Yes.
And I usually say that every female should keep for her at least one day for checkup for her. This is the most important part in the family.
Health is well.
Yeah, and the most important one in the family, and it is the poor of the family. So all of us as the father or the son should take care of of her
lady of the house.
Yes, of the lady of the house.
And it's often said that the woman is the pivot of society, and normally a disease creeps up so slowly. Sometimes there are no signs, and when you come to know, it's very, very late. So that is another part.
So this is the rule of the awareness. You have to check yourself. You do a mammogram once per year.
Yeah.
So if there is nothing palpable, but that maybe appear on the mammogram, so you can come in very early stage and treat it very easily.
Also, Dr. Maher, I'm sure you create this awareness over there that if the woman comes in early, then she probably may not even need chemotherapy, or she may not need a mastectomy. She can do a lumpectomy. So the treatment is not so severe, and less is more. So if she picks up the cancer early at stage 1 or precancerous or DCIS, precancerous or as stage 1, she probably needs less treatment and she can be cured, right?
Also, there is a stage 0 that you can have a complete cure and from the cancer if you come in very early stages. So this is a cure. If you have the concept of the awareness, and every year you can check yourself on monthly basis, and you can go for mammogram maybe once per year, so you can detect any tumor in very early stages, so you can achieve a full complete recovery from the tumor, maybe without chemotherapy, maybe without need of plastectomies. So it is a matter of concept. The awareness is a cure that can give us the weapons that we fight the cancer by treating it in a very early stage.
Dr. Maher, I find it's very, very important for a patient that the doctor communicates very well to the patient and is very kind and is not harsh, because I think the connection with the doctor and the patient is most important.
Yes.
Because if you have a good relationship and the patient can share, can feel at home, she's able to respond to the treatment better. So what do you think about the communication part of a doctor to a patient?
It's a matter of trustability. When the patient trusts in you,
Yes.
You can achieve what you want with the patient, because he feels that he is safe.
Yes.
And is comfortable with the patient, and they usually have the backup and have the communication that can remove any misconceptions or any misleading messages that can be received from the social media or what else.
Very true, very true. Is there any special message that you would like to give to the Indian audience, to our community, to the patients about awareness, or any special message you'd like to give to help us do a better job in the awareness thing, or a message to the women?
I think that all of us agreed upon that the cancer is curable.
Yes.
Cancer is curable, but the cure is the patient itself. If you can come in a very early stage, and if you take care of yourself and you examine yourself in a monthly basis after the end of the period, and you can have a mammogram once per year, so you can come in early stage and let the whole of the journey we can take over.
Right.
But your rule is to take care of yourself, and the cancer is curable.
Thank you, Dr. Maher. Once again, I like to say, for those who can, if they can Google Bahia Hospital in Cairo, Egypt. It's a phenomenal hospital. It's completely dedicated to breast. It's one of its kind. It's very serene. You walk in, you feel safe. You feel wanted, you feel welcome, and everyone's smiling over there. It doesn't feel like a hospital. And I've never seen this amount of patients who come and give back to the hospital. It's flooded with patients who've been cured, who are undergoing treatment and are coming back to help the other patients, right?
Actually, they are volunteering now.
Yes.
After the treatment journey finished for them, they are the volunteers to support the others.
Support.
Yeah, it's the concept of the family.
Yes. And also they have a music room, I noticed last time.
Yes.
So patients come and play music. They jam over there. They have fun. And it's a beautiful way to start a new life and a new journey after breast cancer. Yeah. Thank you, Dr. Maher, for being here with us. And we look forward to having you every year in India for our conference too.
It's my pleasure. And usually you are invited to come to Egypt and Bahia.
Thank you.
So it's my honor.
Thank you so much.
Pleasure to have you. Thank you.
It's been wonderful having you on the podcast with us.
Thank you so
Thank
much.
you.